I call the member for Eden-Monaro.
Thank you, Deputy Speaker. And Deputy Speaker, in my time as member for Eden-Monaro, it has been a constant theme of the constituent issues that have been raised with me in the area of health and the deficiencies of health in rural and regional areas. And it was number one on the issues of surveys that I conducted as a member, and so it was a major focus for my efforts as a member, getting the new regional hospital built, the South East Regional Hospital, millions of dollars committed to a number of primary health provision services, to wonderful super clinics that have done a tremendous job in improving health services throughout our region. And that was because I was listening, Deputy Speaker, listening to my community, to the health workforce. And what we saw at that time was the tin ear of the Coalition on Health Matters. Now, the Abbott government came in promising no cuts to health and education and immediately trashed the National Health Reform Agreement that we entered into with the states in 2011. On top of that, since that time, the predecessor that I had in the electorate between those years of 2013 to 16 also demonstrated a tin ear on these issues. And now we have Senator Molan, who's clearly been appointed by the government to be the official white-hander against me, instead of listening to the community, providing help to the community, meeting with constituents, as I do on a daily basis, and conducting health forums like I do. There was no members of the Coalition at the massive rally at the Bega Civic Centre last year, where there were over 400 people who were deeply concerned about the effects that were being felt in the South East Regional Hospital. There was no one there to listen to them that day other than me and take on board their complaints. Now, I get correspondence regularly about these issues, so it's ridiculous to hear Senator Molan get up last Monday and say that everything's sweet, that everything's hunky-dory in the health scene in our region. Now, this is just one correspondence that I received last night from a constituent in relation to the South East Regional Hospital. This is Mary, who gave me full permission to read this to this chamber. Why, oh why has this hospital been built when it can't afford to be staffed with experienced surgeons, doctors and nurses? The staff that are there are really doing their best, but are run off their feet. A lady who had a stroke and broke her arm 4 days ago is still waiting for a doctor to look at it to get fixed. She is worried now that it will have to be pinned because it has been so long. For myself, I am told by the orthopaedic surgeon that he has referred me to Canberra Hospital, as they don't do redo hip replacements in Bega. It has been nearly 2 months now and still I haven't received an outpatient's appointment from Canberra Hospital. I had my hip replaced when I was 49 years old and it has lasted me 22 years. And as it only just started to go, I was hoping it could be replaced before it became too severe. Unfortunately, I have been told it will be at least 2 years, in which time it will have deteriorated quite badly. I'm a very fit person and look after my weight and exercise regularly. You have a brand new hospital in Bega and unfortunately cannot service all the surrounding areas efficiently. Therefore, we ask you to really look into more funding for this hospital. We are just a couple, but no, there are more. To get sufficient funding, which is desperately needed, would be greatly appreciated by all the surrounding areas. Now, that's not one isolated correspondence, it's just an example. Now, those are the voices that Senator Molan is not listening to, demonstrating his tin ear. Now, these are the official statistics that I have from last month in relation to this hospital. These are from the Bureau of Health Information, which show that waits for elective surgery are still among the longest in the state. The median wait for elective surgery is 206 days. 10% of patients waited 368 days for elective surgery. There are 825 patients on the elective surgery waiting list at the South East Regional Hospital, an increase from the 756 a year ago. Of the 825 patients, there are 430 for orthopaedic surgery, 214 for total knee replacement, 85 for cataract surgery and 66 for hip replacements. The median wait for orthopaedic surgery is 206 days, cataract removal 180 days, knee replacement 248 days and hip replacement 246 days. That's the reality that Mr Molan doesn't appreciate. And this is why Labor has introduced its plan to refund our public hospitals, to refund the issues of elective surgery, MRIs, particularly aimed at helping the situation in rural and regional health scene. Now, I'm listening to this community. I delivered for them before, will deliver for them again. Mr Molan needs to start opening his ears and talk to real people, real doctors, real nurses.
I thank the member.